Hi, welcome back to the next session. It's essential for nurse navigators to have strong communication skills, including writing, speaking, and listening. The Oncology Nursing Society, which is a peak cancer nurses association in the USA, states that communication is a key competency that nurse navigators should possess. In this session, we are going to discuss who the nurse navigator needs to communicate with, how they'll communicate, and why communication is so important. We'll explore what should be considered when communicating with the patient, and we'll provide some tips on how to manage difficult conversations with patients. We will then demonstrate through a role play how to communicate effectively when one of your patients expresses anger, frustration, or confusion.
The nurse navigator needs to be able to communicate effectively with the patient, their family, and all members of the healthcare team. A key role of the nurse navigator is to link the patient to the appropriate services and enhance communication to improve the patient experience, streamline the processes, and deliver quality outcomes. The nurse navigator will communicate with a wide range of people, including the patient's family, patients treating doctors, the treatment team, and external care providers. As experienced nurses with advanced theoretical knowledge, clinical skills, and a thorough understanding of the healthcare system, the nurse navigator can identify the patient's holistic needs and identify what needs to be communicated or what communication is required. Communicating patient-specific needs will facilitate patients receiving integrated care in a timely manner by the appropriate healthcare professional. Communication may be via face-to-face meetings between the nurse navigator and the patient, or the nurse navigator, the patient, and the patient's treating doctors. The multidisciplinary team meetings, via telephone or virtually using Skype or Teams or WebEx. We might use email to communicate. And written communication via a letter or documenting in the patient's medical record. We might even use text messages. Nurse navigators should establish a formal communication plan to ensure that all of those involved with the patient care understand the communication process to enable consistent, effective, and efficient patient encounters. The communication plan should be developed with the cancer care team, including medical staff, nursing staff, pharmacy staff, and the allied health staff where applicable. When developing the plan, it is important to include the purpose of the plan, who the nurse navigator needs to communicate with, the communication goals, how the nurse navigator will communicate, for example, as we said, through email, meetings, phone, IT platforms, communication templates for certain audiences, the resources required, and how you will inform relevant staff about the communication plan, how you will evaluate and revise that communication plan.
Strong communication between the nurse navigator and the patient builds connection and trust. Open and collaborative communication can help the nurse navigator identify the patient's needs. The nurse navigator interacts with the patient at certain times, and we refer to these as touch points. These touch points make up the main component of a nurse navigator's workflow. As identified in the session related to policies, procedures, local guidelines, and processes, it's important for the nurse navigator to develop documents or processes related to their workflow. This document will help demonstrate the steps, the tasks, the processes or activities that are undertaken in a specific order to achieve a particular goal or outcome. Developing a workflow document, such as the touchpoint diagram, serves as a framework for organising work processes to ensure efficiency and consistency. This diagram actually illustrates the main touchpoints that a nurse navigator will have with a patient. At each touchpoint, you're actually communicating with the patient. Let's look closer at the touchpoints. Once a patient is accepted into your program, the first touch point is when the nurse navigator meets the patient and performs a holistic health assessment. This is the assessment we demonstrated in session 3, and you met Annie. This interaction is usually done in person. Remaining touch points depend on the individual patient, their treatment, and their supportive care needs. In this diagram, the nurse navigator meets with the patient after their first cycle of chemotherapy, halfway through their treatment, at completion, and then 2 weeks after their treatment finishes. If this touch point was in relation to a radiotherapy patient, then the touch points would be slightly different. When communicating with the patient, there are several important considerations. You need to encourage the patient to bring someone with them to their appointments as a second pair of ears. State the purpose of any meeting that you might have with them. Make sure that you always listen actively so that the patient feels that you're interested. Be aware of your body language and your tone of voice. Be calm, be relaxed, speak softly. Maintain eye contact with the patient if it's culturally appropriate. And use open-ended questions. For example, what other things would we like to discuss today? And most importantly, when you're educating a patient, you need to minimise interruptions. When communicating with the patient, consider the patient's health literacy. Avoid medical terminology, use simple language, and make sure that you check in with them that they understand what you've told them. For example, can you explain to me, Annie, what we've talked about today? Use silence. Give the patient the time to take that information in. In some cultures, extended periods of silence are actually normal. Silence is valued. Pauses are used to listen, show respect or consensus. Do not think that silence is a lack of understanding, agreement or concern. Observe silence if this is what you feel the patient needs. Communicating effectively and using language compassionately can assist with the patient's understanding, emotional well-being, and their ability to make informed treatment-related decisions. Cancer patients have to deal with so much. It's a roller coaster of emotions in relation to every part of their cancer care continuum. Patients may feel overwhelmed, stressed, or anxious about having cancer, their treatment, their financial situation. So some patients may become angry. This may be triggered by certain thoughts such as, I have cancer, that's not fair. Maybe cancer stuffed up my normal routine. I'm angry because cancer has really affected my family. Anger is a powerful emotion. Dealing with an angry patient is one of the most challenging interactions that you can have as a nurse navigator. It's important for you to know how to handle such situations. Here are some tips to help you in these types of scenarios. Do not be defensive or take what the patient is saying personally. The patient's anger is actually not directed at you. The anger has probably been triggered by something else going on for them. You need to remain calm and respond with care, concern, and empathy. So say things like, I can see that you are very upset. What's causing you to feel this way? Be aware of your body language. Sit down if possible and ask the patient to sit down. In doing this, it shows the patient you're going to take the time to listen to them. But make sure that you give them space. Control your words, your tone, and your body language. When you're in these types of situations, allow the patient to lead the conversation and you listen. Listening is not about waiting for your turn to speak. Sit and wait. An angry patient will generally tell you why they're angry. Make sure you call the patient by their name. Speak softly. Maintain eye contact if culturally appropriate, as I mentioned earlier. Don't interrupt the patient. It's important that you validate what is happening to them. So you might start with, "I'm sorry that this has happened to you. I understand why you are feeling angry." And be honest with them. You need to set boundaries. Keep control and ensure safety. So maybe if you go into another room with a patient, it's a good idea that you sit closest to the door. In the event that there could be some sort of personal safety issue for you, you can then leave if needed. If the conversation escalates, it is okay to remove yourself. You need to make sure that you're there for the patient. Don't ignore their feelings. You may not want to manage anger and it might not feel very comfortable for you, but their anger is real and it needs to be dealt with. Try to recognise when a patient or their family is angry. Identify the cause and support them to manage this emotion. We would like you to watch the following role play. Observe how to communicate if there is a need to have a difficult conversation. Look at the boundaries that are set by the nurse navigator and how the patient's feelings are met. Observe the ways in which we communicate, both verbally and through body language.
This can't be happening. I've done everything that you lot have told me to do since walking into this place. And where's it got me? Nowhere. I'm done.
I can see you're upset, Lucy. Why don't you just take a breath and tell me what's going on?
I'm actually not upset. I'm angry. And I just think that you've gotten it wrong, that someone's looked at those results and that it's just all gone wrong.
You've just seen Dr. Allen, so tell me what results are you talking about? What has Dr. Allen told you?
So I went and saw Dr. Allen. You know how I had to have those scans after I'd finished treatment to see if the treatment had worked?
Yes, I knew you were having those scans.
Well, apparently the treatment didn't work, did it? Like, the cancer spread. Like, what does that look like? Like, I haven't had any pain. I've just been doing everything by the book. And now he's told me that that treatment was worthless and the cancer's there. Like, how can that happen?
I know you have had a bit of a shock and it's not the news you're expecting, but I can assure you it's nothing you've done or anything you could have prevented. Sometimes our treatments don't work the way we expect them to. Can you tell me what Dr. Allen said about the next steps?
Well, I actually don't even know what he said, because I walked into the office thinking it was just going to be the same discussions, and I thought the cancer would be gone and I'd go back to life and everything would be great. But then he said the cancer spread, that was it. I actually didn't hear anything else. I wanted to get out of the room, I wanted to scream, and I just wanted to come to you because, you know, he just said you knew what would be done next.
I do know what's going to happen next. Dr. Allen has asked me to organise some further tests. So your scans have shown there's been some progress with your cancer. Sometimes treatments don't work the way we expect them to, but that doesn't mean that's the only treatment we can do. So we're going to do some further tests, find out exactly what's going on, and then we can make some decisions about what to do next.
But what's the point in going for more scans? That's just more people prodding and poking me, and then he'll go, "Oh, here's another little mixture of drugs that I'll give you, and this will fix up your cancer." But this mightn't work either.
No, we can't say that it will or it won't work, but we need to understand exactly what's going on with your cancer right now. So we're going to do those tests to understand what we can do next.
But I'm not going to die, am I? Like, I just remember when I first sat down with you and Dr. Allen, and he said that I'd probably get on top of this cancer, that it would be okay, and I just don't want to die. I'm too young to die.
Okay, well, we're not at that point yet, and we're not going to think about that right now. We're going to focus on what we need to do now. And what we need to do now is organise those tests. So you're okay if I start to organise those tests for you?
Well, you told me the right stuff the whole way through, so I just have to listen to you, I suppose. So, yeah, go for it.
Okay, have you got any questions?
Not at the moment.
You know you've got my contact details. You can call me anytime. And if you think of anything in between appointments, just write down your questions like you've done all along, and we can talk about them next time. So I'm going to organise those tests, and then I'm going to make an appointment with Dr. Allen so we can discuss our other options. Do you want me to set up an appointment with Dr. Allen to talk to your family so they know what's going on?
Are you going to be there?
Of course, I'm always there. I'll be there with all of your appointments.
Yeah, because when you're there, you just explain everything really clearly, and the family know you, and it's just gonna be really emotional. So if you're there, it'll just help. I know that.
Okay, well, let's focus on what we need to do now. I'll get on to organising those tests.
Let's do it.
Okay, let's do that. Nurse navigators must have strong communication skills. Lisa and I hope that our role play demonstrated how to communicate if there is a need to have a difficult conversation with a patient. When the patient was angry about her results, the nurse navigator responded by acknowledging that the patient was upset and encouraged her to explain what she was feeling and why. The nurse navigator validated the patient's feelings and explained the current situation in a calm and clear manner. The nurse navigator was also honest with the patient and ensured she listened to what the patient was saying. The nurse navigator helped the patient by discussing a plan moving forward and involved the patient in the process. This helped the patient to feel that she was being heard, and the patient relaxed and was prepared to listen. In this session, we discussed who the nurse navigator needs to communicate with, how they should communicate, and why communication is important. We explored what should be considered when communicating with the patient, and I provided some tips on how to manage difficult conversations with patients when they are frustrated. These tips include: do not be defensive or take what the patient is saying personally. Be aware of your body language and allow the patient to lead the conversation and you listen. Validate what is happening for the patient. Set boundaries during the conversation and be there for the patient.